So I'm checking the patient's orders. I do see that the physician has ordered that the patient receives a 12 French catheter with a 10 milliliter balloon. Knock, knock, knock. How you doing today, Mrs. Jones? My name is Tiffany, and I will be your nurse today. Do you mind if I take a look at your ID bracelet? And could you please verify your forename for me and your date of birth? And do you have any known allergies? Great. I'll now perform hand hygiene. Okay. I'll also I have to make sure that I clean the patient's perineal area to make sure of sanitation. I'll only expose what's needed. The area of operation is needed. Okay. I'll get some gloves. And I'm also going to raise the bed to a working height for myself as well. Make it more comfortable for the patient. And while doing so, I'm going to also place the patient in dorsal recumbent position. And also setting up my biohazardous bag as well for when we begin the sterile technique, the sterile procedure. Alright, so I am now going to clean the perineal area of the client. Washing distal, proximal, and the center, making sure that I only use one area of the towel once. I'll dispose of my gloves. Okay. Providing hand hygiene again. I'll now begin to set up my sterile field. First verifying that it's Foley catheter, 12 French, Foley catheter with a 10 milliliter balloon. I'll dispose of this. I'll dispose of this. I now begin setting up my sterile field for the bedside. Make sure that the shiny part is on the bed. I'll now put on my sterile gloves. I'm not going to place a little lubricant in the pan to place on the tip of the catheter to make sure the patient has ease while the catheter is being inserted. I'm also going to put my water, attach the syringe for water to blow the balloon. Okay. I'm also going to check for the opening of the catheter to make sure that it's closed. And it is closed, so urine doesn't spill everywhere. Okay. I am now going to lubricate my catheter without touching the tip to make sure that it stays sterile. Okay. making sure that I lubricate at least 1 to 2 inches for the patient. So I am now going to place my non-dominant hand, open up the labia to clean, okay? Wiping distal first, once, okay? Proximal, once. Down the center from front to back. Okay. I'm going to keep my hand in place. I'm going to now insert the catheter through the meatus of the patient. Okay, I'm inserting until I see urine. I do see urine, so I will then insert for another additional 1 to 2 inches. I'm going to use my non-dominant hand to clamp the cord. I'll then inflate my balloon with water to make sure that it's in place. Okay. So I've inflated my balloon, and I will now tug to ensure that it's in place, and it is in place. I will then attach the catheter to the patient's leg, ensuring that it is set in place, lowering the bag below the bladder of the patient to make sure that it has a constant flow and any urine doesn't flows back up into the meatus, causing interior infection. Okay, so I will now then okay. So I will now then dispose of all biohazardous material. Before I do so, I will disconnect my syringe, disposing of all biohazardous material, okay, including my gloves. Okay. Biohazardous material disposed. Performing hand hygiene once more. I will then lower the patient's leg to a comfortable position. There. Covering the patients for privacy. I will then make sure that the patient bed is lowered for safety. As well, making sure that the bed rails are up. And I will give the patient a call light if she needs any assistance. Alright, so then I will perform hand hygiene. Once again, I will then document to make sure that everything, the patient accepted the catheter well. Okay? And that concludes this video.